Everyone. I think we will start. A very warm evening, afternoon to all of you. Thanks for spending an hour of your time on a Sunday evening with us as we try to discover about our body actually. So today we are here to talk about the frozen shoulder, a very common condition in middle age or population and above. And something I hope that will be useful for you guys in terms of self-managing as well as learning some of the exercises that we will be teaching you later today. Thank you, Mona, for having me and Gareth today to address the participants and to the organizing committee for setting this up. So this is the third part in this series. We started out by talking about common knee conditions, and then we spoke about back pain and causes of back pain, and today we're talking about a very common shoulder condition. So without further ado, could you just share my slides? Okay. So just setting some ground rules. If you could mute yourselves through the course of the presentation, unless of course you have a question to ask. Questions are welcome either by unmuting yourself, raising your hand through the course, and asking the speakers. You could also type your questions in the chat box for us to answer during the Q&A session. Or again, like I said, during the Q&A session, after the two talks have been given, you may raise your hand, draw our attention, and ask us verbally as well. It would be great when you ask a question if your video could be on so that we could see who we are speaking to. And with that, I'll start. So I'm Hamid. I'm consultant orthopedic surgeon at Sengkang General Hospital. I also have an academic position at Duke NUS Medical School, as well as Lee Kong Chian and Yong Llewellyn Schools of Medicine. My main research interest is in mechanics of the musculoskeletal system, and I'm also a sports and joint preservation surgeon, doing surgery for the shoulder, hip, and the knee joints where necessary. Today, I'm also very glad to introduce a friend of mine, as well as a esteemed colleague, Mr. Gareth, who's a principal musculoskeletal therapist and the director at Heartland Rehab. He has special interest in treating patients with low back and neck issues, and patients with frozen shoulder do form core of the patients that he sees in his practice as well. So without further ado, I'm going to dive right into the topic of frozen shoulder. I'll give you a very broad overview of what the condition is, and in layman terms, as much as possible, explain what the condition means to you as a potential patient. And of course, Ms. Gareth will touch on the therapy, both in terms of preventive therapy, as well as if you do suffer from frozen shoulder, what are some of the exercises that will be useful to you. So I always like to start off by showing a diagram of what a shoulder looks like on the outside and what actually it is much deeper. As we know, the shoulder joint, God gave us a very mobile joint, and this is because we need our hand to pick up things. So the shoulder by nature is a very mobile joint. It can move in many different directions as compared to the hip joint, for example, which is a very restricted joint because you require stability to walk, whereas the shoulder is responsible to really put your hand in space to take things out. And because of this, there are certain drawbacks and potential for injury if you go beyond what is normal movement for the shoulder. Having said that, there are certain things that contribute to stability of the shoulder to keep your joint stable, and that comes from firstly the bones, the ball, and the socket itself. But this socket, unlike the hip joint, is not a deep socket. It's quite a shallow socket, right? So the shoulder bone is a ball, and the other side, the socket, is a shallow socket. So to strengthen this socket joint, there are many different layers of tissues in the joint. The first layer is what we call the capsule. The capsule is really like a plastic cling wrap that cling wraps around the shoulder joint to keep it stable. And then above the capsule, you have what is called the muscles, all right? What you see in this diagram as the rotator cuff muscles. Now, these are very strong muscles that help you move your shoulder sideways this way, forward this way, and outwards this way, right? And these muscles often are also strained as we age because their blood supply reduces as we age. And there are other stabilizers of the joint, such as your biceps muscle, the big muscle in your upper arm that helps you to do this movement. So that's the biceps muscle. And don't worry about all the technical terms on the right-hand side of the diagram. All these big red things that you see are the rotator cuff muscles, each with its own name, such as the subscapularis, the supraspinatus, as well as the infraspinatus. These are all just fancy medical names for the group of muscles known as the rotator cuff muscles, right? These are important for you to know because we will be targeting some of this when we do the therapy. And when I explain to you what frozen shoulder is, I'll also draw relevance to some of these structures that are in your shoulder joint. So the definition of frozen shoulder, it's a very simple name. It is called frozen for a particular reason. I'll explain later. Scientifically, it is known as adhesive capsulitis. Now let's look at this word adhesive capsulitis. The term adhesive alludes to the fact that obviously things are gummed down, right? Adhesive, is refers to glue. So what happens is the entire shoulder feels like it is gummed down and glued to each other such that you can't move it. And capsulitis, the word itis in medical terms generally refers to inflammation. And therefore, it also alludes to the fact that the capsule, that shrink wrapping tissue that I mentioned earlier, is inflamed. So when a capsule gets inflamed, it essentially glues down the shoulder such that you can't move it. And as a result of that, you get pain and stiffness. Now, the important thing to know about frozen shoulder that there is actually no known cause for it, right? So for example, if you do have a shoulder injury, like you either have some form of arthritis that is already been diagnosed by your doctor, or you have some form of injury to the tendon or the muscle in the shoulder, then technically you cannot call it frozen shoulder because your stiffness and your pain may be a result of an injury or a problem that you already have that has been diagnosed. So frozen shoulder is actually, puristically speaking, a condition that has no known cause. You just get it. Your muscles are fine. Your joint is fine. The X-ray looks normal. The ultrasound didn't pick up any injury internally, and that is truly called frozen shoulder. Other conditions such as rotator cuff tears, like the muscle tears in the shoulder, or if you had a previous shoulder dislocation, or if you have some form of arthritis in the joint, can also cause pain and stiffness. And that is usually known as either secondary stiffness or secondary frozen shoulder. So frozen shoulder in itself, if it happens on its own, there usually isn't an underlying cause that causes it. So I bring your attention to the diagram here. You can see this white structure. Can you give me a thumbs up if you can see my arrow? Do you guys see my arrow moving around? Gareth, do you see my arrow? Okay, great. Thank you. So you can see this white structure here. This is the capsule I talked about, and this is essentially the tissue that is involved in frozen shoulder. And you can see below, the capsule looks red and angry. And truly, this is what we see if we were to open up your shoulder and have a look at a capsule. It looks red and angry because it's inflamed, and this capsule restricts movement of the shoulder in frozen shoulder. So why does it occur? As I mentioned, in primary frozen shoulder, the exact cause is unknown. But we do know from studies, research that have been done on large population basis, that patients with diabetes and thyroid conditions are at higher risk. If you take all the people that are affected with primary frozen shoulder, there is a significant number of people who suffer from diabetes and thyroid problems. We do not know why. Some people have suggested that it is the sugar molecules in diabetes that deposit itself in the capsule, and that causes the inflammation. And similarly, in thyroid disease, because of the problems with metabolism with the thyroid hormone, there is no repair that takes place, and therefore the capsule gets inflamed. And unfortunately, in patients with diabetes and thyroid issues who get frozen shoulder, they also tend to run a very delayed course of the problem. In someone without diabetes, the frozen shoulder on average lasts for a period of between 6 to 9 months before it gets better. But it may be twice as long in someone with diabetes. It may take about 18 months to even 24 months to get better if you do get diabetes. That's not to say every patient with diabetes will get frozen shoulder, and that every patient with diabetes who has frozen shoulder will take that long to recover. But it is just a known fact that patients with diabetes do take longer to recover from primary frozen shoulder. And as I mentioned earlier, secondary frozen shoulder can develop, for example, if you keep your shoulders still for very long. For example, if someone has suffered from stroke or a heart attack and they're rehabilitating and they're not moving their shoulder much because their shoulder is being kept in the same position for a long period of time, the capsule again undergoes inflammation, it gets stuck down, and as a result, they're unable to move the shoulder. This is the same when you go for shoulder surgery for a particular condition, or you have a major injury to the shoulder, either a dislocation or you tear a muscle in the shoulder. And as a result of that, you have intense pain, right? And you tend to not move your shoulder. You keep it on an arm sling for, say, 2 to 6 weeks because it is comfortable for you. And then you say, wow, now I really can't move my shoulder anymore. The pain may have gotten better from the initial injury, but now you have a new problem. You have what is called secondary stiffness or secondary frozen shoulder. So this is really the crux of the matter, and I want to really focus my effort today in explaining why it is called frozen shoulder. So you can see there are three different phases when we talk about frozen shoulder. The first phase that can last for about 3 months is called the freezing phase. The second phase is called the frozen phase, and that is when a bulk of the time of the duration of the frozen shoulder is spent in, 9 months. And the last phase is the thawing phase, right? It's pretty much analogous or drawing attention to what you would do when you put a food in the freezer. So the initial stages, you can see there are two curves here. The blue curve refers to movement, right? And the red curve here refers to pain. So you can see in the first 3 months when it is in the freezing phase, your movement gets worse, whereas your pain starts to increase. And this is pretty characteristic in the early stages of frozen shoulder. Patients always come with um, good movement but increasing pain, and as they go on, their movement gets worse and the pain increases. And this is if they do not intervene early with exercises, of course. And in the middle phase, in the frozen phase, you can see that pain is at a maximum, is at a peak. And this is when patients really suffer because they have a lot of intense pain due to the inflammation, and their movement is at rock bottom. You can see that, and they hardly move their shoulder, especially external rotation, the movement of bringing your elbow outwards. That is really affected, and as well, reaching behind your back to scratch your back or to dress yourself up, that is also almost impossible in these patients. So again, the frozen phase is very characteristic. Pain is at a peak and movement is at rock bottom. And subsequently, in the thawing phase, again, like I said, nobody knows why does it get better on its own. It just decides to thaw the shoulder. You can see that pain normally becomes less of an issue, and slowly but surely you get back your range. Now, it looks like I'm painting a really terrible picture, but the good news is that with self-administered exercises and by seeking professional help in the form of early therapy, when you have signs and symptoms of frozen shoulder, which I'll be going through in a while, you can reduce the total duration, not just in each phase, but from the total duration of 9 to 18 months, you can try to bring it shorter, which means the entire process of freezing, frozen, and thawing can be shortened so that you suffer for much less than what you would do if you didn't seek help for this. Okay, let's see. I have a chat. Yep, I've gotten all your questions. We will address these questions subsequently. So how do we diagnose frozen shoulder? As with all conditions, be it an orthopedic condition, a joint condition, or a medical condition, the doctor that you visit will take a history from you. And what sort of history are we asking? We will ask you how long you've been having the pain for, whether you had any injury prior to the pain, and what movements can you and can you not do, and how does it affect your function. And we're really interested to find out how this condition affects your day-to-day activities. We'll go into detail about what work you do, how does it affect your work, and what are the household chores that you're doing and how it affects your household chores. Because as doctors, we want to help you get back to your normal life. With that, like I said, in the history, the main important things in frozen shoulder is pain and stiffness. These are the predominant symptoms one would expect in this condition. And of course, the doctor will follow you up with examination of the shoulder. And very classically, in frozen shoulder, there will be limitation in movement of the shoulder in all directions. It won't be in one particular direction unless it's very early on, or if you have an underlying injury to the muscle that causes that movement. But in primary frozen shoulder, in the classical frozen shoulder, it is the fact that the patient will not be able to move in all directions, front, side, and backwards. They won't be able to move the shoulder, or it will limit it. And sometimes as physicians, we try to help to move, and even the physician won't be able to move it for you or the patient. And so there is a mechanical block to movement, and that is what we find. And often we want to make sure that we are not missing a fracture or we're not missing a arthritis, and we'll do a simple x-ray of the shoulder, which most of the times turns out to be normal. At this stage, the doctor will decide whether to send you for further imaging, such as an ultrasound scan, to make sure that none of the structures in the shoulder I mentioned earlier, like the rotator cuff muscles, the muscles that help to move the shoulder, or the biceps tendon, for example, is torn or injured. Now, if the ultrasound shows that these structures are not injured, then we make a diagnosis of frozen shoulder. Because again, let me remind you, in frozen shoulder, the shoulder is actually structurally normal. There's no injury to the shoulder. Things inside the shoulder, the muscles and the tendon should be normal. And that is how we diagnose primary frozen shoulder. And then the doctor will likely tell you the importance of physiotherapy and refer you to a therapist to institute aggressive physiotherapy to help you recover. So now, what are your treatment options? Now, as a physician, I take my time to explain exactly what I told you today. I will explain to the patient that, this is, you have to stand the test of time. While therapy can try to shorten it, patience is important. And you just have to stand through the passage of time for it to get better. But there is help available. For each phase, we have certain key things that we look out for. In the very painful phase I mentioned earlier, the freezing and part of the frozen phase, we will always give pain-killing tablets, which can be paracetamol or other types of painkillers, as well as specifically anti-inflammatory tablets, because this helps to reduce the inflammation of the capsule, and that helps you in your therapy as well, because the early stage when you start therapy is going to be really tough, because you'll be combating your pain and you'll find that the movement is already so painful. How am I going to get the therapy done? So it is important for you to take the anti-inflammatory medications that your doctor gives you so that you can start therapy promptly. The therapist will also be able to include pain controlling modalities such as heat packs, and ultrasound based therapy to control pain and inflammation. And sometimes I do give injections into the not into the shoulder itself, but around the shoulder, because this helps to reduce the inflammation in really severe conditions. But a word of caution, I always ensure that the patient doesn't have a torn muscle or an injury to the tendons in the joint, because part of the injection involves giving steroids, and steroids carry the risk of rupturing tendons. So I must absolutely make sure that there's no existing injury in the joint before I give a steroid injection. And like I mentioned, physiotherapy is the mainstay of therapy. It's the most important modality in treating frozen shoulder, which Gareth will touch on later. And there have been some studies to show that acupuncture actually helps in the pain control as well. It doesn't help to get your movement up, for which you need therapy, but it helps to reduce inflammation and reduce the pain which comes about because of the inflammation. In the stiff phase, there is really nothing much a doctor like me can do in terms of medication, but you really need to undergo your physiotherapy daily by yourself, guided by a therapist, maybe once in a couple of weeks. There is this treatment modality called hydroinsufflation, which is actually done by a radiologist. Basically, we put a needle into your shoulder and we pump it with high pressure water, and we hope that the water will try to expand the capsule that is stuck down to cause the capsule to become loose. This is I would say, not extremely successful in all patients. It is worth trying if the patient is really afraid of going for surgery, and is only reserved for patients who are having really prolonged symptoms. For example, beyond 9 months and they're still not making any progress with physiotherapy. To get them up, we do get our radiologists in our hospital back where I'm practicing in Sengkang to do this as a in minimally invasive procedure, because you don't have to go to under anesthesia for this. Just a simple local anesthesia. They inject a needle into your shoulder, and they use this specific device to pump fluid into the shoulder joint to expand the capsule. Last resort is surgery. So even though I'm a surgeon, I'm always very honest with my patients that frozen shoulder does not need surgery. There's only 1 to 5% of patients whose symptoms may be very persistent, and these patients tend to have diabetes or other medical problems. And basically, even with physiotherapy and medication, they're not getting better, then I would opt for surgery. And surgery is essentially putting you under anesthesia and then forcefully manipulating your shoulder and tearing out all the capsule that is stuck. We're literally just stretching and tearing the capsule away from the joint so that you can move. And in some patients, again, patients with diabetes, they may require a proper surgical release where we use keyhole surgery to put in a scissors and knife into the shoulder and literally cut the capsule to release it from the bones of the shoulder joint. And often after this, they still need to undergo intensive therapy so that they be able to get back their movement. Let me just check the chat box again. Okay. Okay, so that's all I have for you guys in terms of the medical management and the overview of frozen shoulder. I'm happy to take any particular questions related to what I've shared. You can share it with in the chat box or switch on your video, raise your hand and ask it. There's one question currently: is there medication for the inflammation? Absolutely. So as I mentioned previously, we do have many oral medications that combat inflammation. These are known as NSAIDs, NSAIDs, it's called non-steroidal anti-inflammatory drugs. You would have taken it in the course of your of treating yourself, These are like your Ponstan, your Acoxia, your naproxen type of medication, which really are targeting to reduce the inflammation, not just in the shoulder, but anywhere in the body. But obviously in frozen shoulder, we give it in particular relevance to reduce the inflammation of your capsule. For example, the injection that I spoke about earlier, steroids are the other things that we can give to reduce inflammation, but these are much more effective if it's injected around the shoulder joint itself, so that they can have a local effect at reducing the inflammation. So that's the one question there. Is there anyone else with questions pertaining to what I've just discussed? Yes, there is. Any exercise to prevent having frozen shoulder? Absolutely. I think Gareth will soon be sharing on what we can do on a preventive strategy. Some because we are at a risk population, we want to include some exercises in our daily routines so that we do not end up being at risk to this, as well as we want to be able to do it when the strike it when the iron is hot. You don't want to wait till you have full-fledged frozen shoulder. You want to do it when you have already the slightest doubt that your shoulder movement is affected. You may want to seek professional help, get it diagnosed, and start therapy early. Like I said, if you don't listen to your shoulder when it whispers, you really do not want to contend with it when it screams when it has a full-fledged frozen shoulder. So perhaps I'll pass the mic over to Gareth to continue speaking. We'll have plenty of time after Gareth's talk to take questions from the ground. Gareth, over to you.
Okay, let me just share my screen. Okay, so just carrying on from where Dr. Hamid has shared. So I just want to share from a physio perspective as well, like some of the telltale signs, when people come in, and like how do you roughly know or that the shoulder is something, or rather there is some telltale signs of frozen shoulder. So one of the things that a lot of clients with frozen shoulder come in, they say they're unable to take their wallet out of their back pocket. For the ladies, they're unable to unhook their bra. Okay, so there's a lot of the hand behind back kind of movement, and this thing called a capsular sign, where internal rotation, where you put your hand in behind, external rotation, flexion, and abduction. What Dr. Hamid said, all this range is very limited because the capsule is limiting it. Okay, and if you come in and there's no mechanism of injury, meaning you just woke up and suddenly you start to feel that stiffness and that pain, you don't remember knocking your shoulder into anyone or falling down. Yeah, so then that would be suggestive of it. That's where we have a few diagnoses in our mind. Okay, and one of the major telltale signs is when your active range of motion, the limited active range of motion, is equals to your passive range of motion, meaning when you try to move your arm, it's stuck here and there's pain. And when the physio or the doctor tries to bring it up, it's stuck too. So it's quite equal in that range of motion. Then that's quite suggestive of frozen shoulder. Okay. Of course, then we have to rule out other things like your rotator cuff tears, your bursitis, and fractures to the shoulder. Okay. So if you do have any of these, don't just like sit at home quietly. Do find a doctor your GP or even a physio to do some assessments. Okay, so what are some of the goals in rehabilitation for frozen shoulder? I'm just breaking it down to 3 simple things: pain relief, range of motion, and strengthening. Okay, so pain relief, in that sense, what we can do for pain relief is to do some gentle movements with your shoulder. Okay, so sometimes if active movement is painful, you can do pendulum exercises where you either move your arm with the unaffected side, or even like hanging your shoulder down and then just rocking it around. Okay. Heat pack can help. Okay. A heat pack can help because it can help to relax the muscles that are surrounding the capsule. Sometimes with that kind of pain, the muscles tend to tense up, and the pain you're feeling can come both from the inflamed capsule as well as your muscles that are tightened up. So if we can actually lessen the pain coming from the muscles, there is some form of relief as well. Certain physiotherapists in the private practice, we do this thing called dry needling. Okay, it can help with muscle related tensions. Then again, so it doesn't solve the capsular problem. Okay, it really works with relaxing the muscles around the shoulder. Okay, and another thing that we need to remember: if it's injured, don't keep injuring it. So we need to avoid carrying load. So when you have you're diagnosed with frozen shoulder with your left shoulder, okay, avoid carrying load. Don't go and carry your 5 kg bag of rice and then ask how come it's still so painful. When you just keep on aggravating it. Okay, or overstretching. So sometimes when you start to get some pain and stiffness, and then with the physio exercises, or you go on YouTube and you find some exercises for frozen shoulder and they show you to do certain actions, and then you do it, and then you force it thinking that no pain, no gain. Okay, so there is some progression as we go through. So we do want to manage the pain first, okay, and then we work into the range of motion at the same time. Okay, so just some simple things that we can do, as well as ultrasound therapy. So that helps with inflammation, controlling inflammation. Okay, so in terms of range of motion, what we want to do is actually to maintain available range during the freezing phase. So remember the 3 phases that Dr. Hamid talked about: freezing, frozen, and thawing. Okay, so during the freezing phase, that's when you start to feel that the movement is restricted and your pain level starts to go up. Okay, that's a lot of times when people will start to avoid movement. Okay, and when they start avoiding movement, it actually causes you to lose more of your range. So during that point of time, when you start to have that, if you were to see a specialist and get this diagnosed, actually what we would promote or encourage is maintaining whatever available range there is and working into it. Then when you go into the frozen and the thawing phase, what you want to do is to gain more range. Okay, whatever range that you have at that point of time, you want to slowly work into it and get your capsule stretched out, get your muscles not shortening, so that we can get more range into the shoulder as well. Okay, I'll talk about some of these exercises later. I just run through these 3 goals first. Okay, and then the third phase or the third goal in rehabbing for frozen shoulder is strengthening. A lot of times when we don't move into a certain range because of pain, the muscles become weaker, and especially into that range that we have lost. So as we get back more range, we also do want to strengthen into that new range that you have gained back. Okay, so that's very important, because a lot of times when we have full range but we don't have strength, okay, and then we start carrying things and doing things as before we got this frozen shoulder, that's when it's a perfect recipe for a shoulder injury, like a rotator cuff tear or different kind of like a shoulder bursitis. Okay, so we do want to work in the strengthening of the muscles around the shoulder. Okay. So I'm just going to talk more into the range of motion exercises for the purpose of this talk, and then from here we also can come up with some plans how to prevent frozen shoulder, which is really just to get the shoulder moving as much as possible. Okay. So range of motion for the shoulder is the joint in the whole body with the most planes of movement. Okay, there are 2 ball and socket joints, the shoulder and the hip. The hip is stable, like Dr. Hamid said, because that's where we used to walk and a lot of weight goes through it. the shoulder is used to reach into space. That's why it's the most plane of movement, and it's also out of the two ball and socket joint is the one that is the least stable. Okay, so first plane of movement that we want to focus on in terms of rehabbing for frozen shoulder is actually the front plane. Okay, so which is going up this way. And this is very important, you know, when we want to take things off the shelf, when we want to hang clothes, when we want to reach out to take things from the table. So this front plane is where most of us as human beings, we tend to work with things in front of us. We hardly work with things behind us, yeah. So the front plane. So wall crawl is one very basic exercise. So put your arm on the wall, then you slowly slide it up. Stop at the end of your available range. Means when you go up, you start to feel that stiffness, okay? Try to crawl up with your fingers, okay, until you feel pain. When there's pain, stop there, hold it for 10 seconds, okay, and then you slowly slide it back down. Okay, so once you feel a pain score, let's say 0 being no pain, 10 being the worst pain you've ever felt, you hit about 4 to 5, okay, that's okay. We just maintain it around there, nothing beyond a 6. So just crawl up, feel the stiffness, try to go a little bit more, feel a little bit of pain, that's fine. Hold it for 10 seconds, and then you slowly slide it down. Okay, you can do this as often as you can through the day. Try to get in at least 10 times, 5 sets. Okay, because we actually do move our arms a lot more than we think we do. So doing like maybe 10 times a day is really not enough for the shoulder. Okay, so 10 times 5 sets, or you can even do 10 times every hour. If you are really experiencing a lot of pain and putting one hand up like that and crawling up the wall is next to impossible because of the pain, what you can do is to clasp your hand, okay, put it against the wall, okay, and then use your unaffected arm to help slide it up. Okay, slide it up until you feel the stiffness. If you can go a little bit more, okay, a little bit of pain, hold it there. So you have your unaffected hand helping to support, but what we do want is the range of movement. Okay, so that's one way that you can do it. Okay, so even I'm just going to teach another way that for those who are in a lot of pain, you can't even put your hand on the wall. Okay, another way is to put your arm on the table. Okay, and then push your arm out, bending your body down. Okay, I'm just gonna, let me just see if I can. Okay, so you put your arm on the table, okay, and then you slide your arm outwards. That's also one form of shoulder flexion to the front. Okay. Next thing that we're going to talk about is shoulder abduction. So crawling up the side. Okay, so it's similar to the front one, just that now you go sideways. Okay, and then you put your arm up, and then you slowly slide it up. As you get up, okay, you can step closer to the wall so that you get more range in. Okay, so same idea, stop at the end of the available range, limited by your pain. Okay, then hold it for 10 seconds, and then you slide it back down. Do it 10 times, 5 sets a day. You can do more than that, or even 10 times every hour. Okay, so same thing for this. Okay, if it's too painful to put your arm up, you can put it at the side of the table. Okay, then just slowly slide it up. Okay, once sliding on the table is fine, then you should have enough range to go up the wall already. Okay. Okay, the next thing we're going to talk about is this range called external rotation. So external rotation is going outwards this way. Okay, so going away from your tummy. Okay, so for this you can get a stick. Okay, get a stick. Okay, or even an umbrella. Okay, so umbrella is also a good tool to use for this. What you want to do is to keep, if you look at the picture, keep your affected arm, okay, close to your ribs or to the side of your chest. Okay, so keep it close. Okay, one way to make sure that you don't compensate is to put a towel roll between your elbow and your rib, and make sure when you're doing the exercise, the towel doesn't drop. Okay, use the unaffected side, okay, to help push the arm outwards. Okay, use your unaffected side to help push the arm outwards. Okay, so as you see in the picture here, okay, he's using this arm to push the other arm outwards, and the elbow is close to the ribs. Okay, so this helps with the external rotation. Okay, so Same thing, hold it there for 10 seconds. Okay, then bring it back 10 times 5 sets a day. Okay, the next movement that we are looking at to target is your hand behind the back, or this is what we call internal rotation of the shoulder. So we bring it in and then we go behind our back. Okay, so how I usually teach my clients, the first step to this is to focus on bringing the affected arm. So if you look at this person in the picture, his left arm is the affected arm. So it's to bring your left arm closer towards the right side. Okay, so bring it across. When you can fully reach across to the other hip, okay, then you focus on bringing it upwards. Okay, so if you can't even reach to the other hip, don't try bringing it upwards yet. Okay, so this is just a different capsular pattern. Okay, so when you want your arm to go internal rotation, so bring it across, get a bit of stretch into the capsule as well, then bring it up, because that's when the ball joint goes into the internal rotation more. Okay. So same thing, hold it for 10 seconds, limited by your stiffness and then pain. Okay, then let it go. Do it 10 times, 5 sets a day. Okay, and the last thing that we can work on is this thing called your capsular stretch. Okay, so it's a lot of us do this before we go running, okay, or when we do a sport. So it's really just to bring it across, okay, and then bend your elbow in. Okay, that will get you a nice stretch around your shoulder. Of course, calling this a capsular stretch, it does also stretch other muscles like your deltoids, your deltoid muscle. Okay, so you will feel that stretch into your muscles, but don't worry, it will stretch all the structures that are required when we do this. Okay, so bring it across. When you feel the pain, stop. Okay, same thing, pain or stiffness, stop there, hold it, count for 10, okay, then you release it out. Okay, so this is for what we call this range of adduction of the shoulder. So we've gone through all the planes, so flexion, abduction, internal rotation, external rotation, and adduction. So the main thing, if you realize about rehab for frozen shoulder, is really gaining range through the different planes of movement for the shoulder. Okay. One thing that I want to talk about also is prevention of associated pain. So a lot of times when our shoulder is stiff and we try to do certain actions, we compensate. So for example, when we want to take things off a shelf and we can't reach up, what we will do is we will hike our shoulders. Right? That works your upper traps a lot. So a lot of people feel like, oh, it's not just the shoulder that's painful here, it comes up and spreads up to the neck. Okay, so that's just purely because we are compensating. So one common muscle or one common thing that I usually teach my clients with frozen shoulder, even before they feel the pain, is to always to do the upper trap stretch. Okay, so pull your ear towards your shoulder. So if it's your right side that is affected, then pull left ear towards left shoulder. It's your left shoulder that's affected, then right ear to right shoulder, just to stretch. Or you can do both sides. Okay, and of course, what you do for this is to hold it for 30 seconds and do it 10 reps a day. Okay. So in terms of rehab for frozen shoulder, what we aim to do is, as you come in, we always measure your range. Okay, range measurement of the different movement, and we will show to you how, as you do your exercises, the pain level might be the same. Okay, during that phase, so during that frozen phase, your pain level might be the same over that 3 to 9 months. Okay, but the idea is that even with the same pain, you get more range. Okay, so just to get some expectations right, it's not that or when you come to physio, then as your range goes up, your pain will automatically drop down. It's not always the case. A lot of times what we are looking at is the gain in the range, where maybe last time at 90 degrees you used to feel pain. Now at 90 you don't feel pain, but at maybe 110 or 120 you start to feel the pain. So that is in itself a sign of progress of your condition. Okay. So how do we then prevent frozen shoulder? Okay, number one is to just be very active with your shoulder. So you can do things like this in the morning, stretching up, Okay, stretching across, reaching to the back. Okay, so these are the common planes of movement for our shoulder. Especially so if you've had a shoulder injury or shoulder operation, certain things like rotator cuff repairs, or even for certain operations like limb node removal, where the shoulder joint is being kept below 90 for a while. It's really just about getting as much range of movement into the joint so that the capsule doesn't lock up and freeze up. Okay, in terms of primary frozen shoulder, keeping it as active as we can is one way, but as Dr. Hamid has rightly pointed out, we don't know what causes it. So we do have clients who are sedentary, they don't move their shoulders at all, they are always constantly in front of their computer and they never experience frozen shoulder at all. And then we have those very active people, every day they swing their arms, they go for their morning walks, and then they come in with frozen shoulder. Okay, so but that being said, the idea is really minimize the risk of getting that frozen shoulder, minimize it. You know that you'll be moving your arms, and we know that not moving can cause secondary frozen shoulder. So it will always be healthier if we just incorporate certain movements, you know, reaching up, going to the side, okay, across, and to the back. Okay, can. So these are ways to so-called prevent it. And then if you do get it, then it's really doing these few exercises to work into the range, okay, really limited by the stiffness and then by the pain, and getting that range in. One thing that I can advise also is that as technology advances now, some physios do recommend wearable technology where you put on certain technology that you have that can measure range. And then that's when you can track your progress through the days and through the weeks. A lot of times people get discouraged to do physio is when they feel that it's the same. But it's very much feeling because the pain is still there or the stiffness is still there. But if you actually have numbers to show that you are improving, that's when you'll be more motivated to carry on with the home exercise therapy that is being prescribed to you. Yeah, so that's the benefits of wearable tech in this age that we live in. Yeah, so that's about all the exercises that I would share for today. I can hand the time back to Hamid.